So Debbie, today we're joining Lindsay Ford and with a great premise of permission to eat.
I love this for us.
Especially for me, because I don't really use permission, but I need to make better choices.
You know what we're talking about?
I do it.
We're going to be talking about trends in 2026 as it relates to permission to eat. So you're not going to want to miss this podcast.
Let's say you have a really busy day. You don't have time necessarily to sit down for lunch. Your blood sugars will naturally stay elevated to deal with the task at hand because our body's really smart. It knows that it has to deal with these things immediately. Are we necessarily hungry?
Nope.
No. But what happens around 5 o'clock when the day is done?
Starving.
We're starving. So once our body has the time to kind of settle down, we finally get to unwind. You've had a very high stress day. Guess what we want to eat?
Something as fast as I can get.
You want quick, easy. For some, it's sugar.
Because I'm emotional.
And it only makes sense that we're going to want quick, easy, comfort, soothing type things.
Mind your health. You got to mind your health. Mind your health. Treat yourself. You got to mind your health.
Hi, and welcome to Mind Your Health. Dr. David Burke and I are very excited to introduce Lindsay Ford. She is a licensed dietitian. She works a lot in the field of eating disorders. She has a business called Permission to Eat, and she has become quite the icon in the field of food and nutrition. It is an honor to talk with you today. You're quite the speaker extraordinaire, which is really, really excited. And you've got a lot to talk to us about. Lots of things are trending for 2026.
Lots of things. Yeah. Thank you so much for having me. I'm excited to talk about it.
Well, before we even get started, let's talk a little bit about your background and how you got into this.
Yeah. So I actually went to Ball State University, which is in Muncie, Indiana, thriving metropolis. And I went there actually for exercise science. That was my undergraduate degree. I didn't know what I wanted to do, but I loved movement. I played soccer.
Yeah, I was going to say you're a soccer player.
Yeah, yes. I love soccer to this day. And so, yeah, it started there, but I had personally experienced challenges with food, and it shifted very quickly, really intensely to an eating disorder.
Okay.
And at the time, this was over 20 years ago now, I can't believe I've been saying that, is there really wasn't a ton of support. And my parents, I remember at the time, they didn't really know where to go, what to do. So it was really a lot of bunkering down and seeing different professionals in that outpatient type setting. And through that experience, it showed me compassion, it showed me empathy, it showed me a lot of different things that I knew at some point down the road I wanted to pursue a degree in nutrition. And also I knew at the time I wanted to complete what I had started. And it probably wasn't the best time for me to dive into nutrition, as I was still trying to work through my own relationship with that. And so that's really where it started.
What are some of the things that you are doing now and that you have done in this field of exercise physiology and nutrition? And how is nutrition different? You're a dietitian, you're a licensed dietitian. How is that different?
Yeah, so a registered or licensed dietitian has to go through, I would say, intensive schooling. There has to be a nutrition degree. Now you pretty much have to have a master's degree in nutrition in the field of dietetics. And there is a dietetic internship that you have to complete. So you are placed into different medical community, different types of settings. What's really great is the school that I went to, is that they also wanted to put me into areas that I was interested in.
Sure.
And it wasn't, we're just going to plop you over here and, where you're like, I don't think I see this in my future. So my professors, my mentors were amazing in getting placed into really great settings. And then from there, you have to finish and pass a registered dietitian exam and then get licensed in your state and continued education. So it is a pretty intensive process. I say that I went to school for 7 years, and I'm like, I could have come out being who knows what, but
So the other question is, what is that about? What does a dietitian do? Is it about carbs and protein? Is it about what I can and can't eat? Is it about the right diet or exercise? What's it about?
I would say the foundation is meeting the individual, at least for what I do, is can we look at the person? Can we look at individual health if we're doing that more one-on-one? It probably is going to depend on the type of setting that you're in. So if you're in athletic setting, if you're in public health, I mean, there's going to be different types of settings. So I'd say in general, it is looking at so many different variables that's going to influence somebody's food choices. What are some underlying health conditions that might, so it is so broad. I mean, it is so broad. I mean, you have dietitians working within the school systems. You have dietitians working in hospital settings. You have dietitians working with sports teams, which I think for a while, that's what I thought I was going to do.
Okay.
But yeah, it's very vast.
And then where does that shift into like an eating disorder thing?
Yeah. So in an eating disorder, you can work at a residential, you can work in outpatient, you can work with different universities and sports teams as there as well. But yeah, I would say there's a lot of collaboration that's involved with a dietitian that's going to work with anybody diagnosed with an eating disorder, or there's concern there. Is then at that point you want collaboration with licensed therapists, with MDs, with pediatricians.
Do you ever, I know you didn't get in there fast enough.
Yeah,
I saw you.
she is that down the door.
I saw you opening
But
up
I ought to go back to schooling. I heard it. I had a great talk by an IBM futurist, and he said if we want to change the culture in the whole entire world, we need 2 teachers in the elementary schools. We need a life coach and a health and wellness coach. And the life coach teaches, don't save 10%, save 10% of your money, to only buy it if you don't buy on credit, all those kind of life skills, checkbook and credit cards, all that. And then the health and wellness coach is making the better choices, water instead of soda, cut up apples and fruit instead of chips and that kind of thing, and exercise. He says, you put those 2 teachers or mentors in 1st, 2nd, 3rd grade. He says you can change. It's going to take you a generation, but you will change the world. And we don't do it.
We don't. We don't do it. No. I will say this. This is probably I don't know if it can come across as negative, but also its reality is I don't know if the dietitian or somebody that has that profession, I don't know how valued it is.
Okay.
I wondered that.
What makes you say that?
I mean, I'll just use an example. I was watching the news and they're doing a segment on nutrition, and it was an influencing mother from Texas.
Okay.
I'm just putting that out there.
Okay.
That's their choice. They can cheat, but why not choose?
Correct.
Why not?
It's exactly what we talk about on Mind Your Health, to be honest. It was commentary, my point of view versus evidence. This is what we can.
Yes.
Has been researched and we know.
So could there be value? If we implement this, is there research to support that it's going to be effective? What's happening within the home? Do we have the financial means to support those kinds of programs? What happens with the low income? So I think there's so much involved. And I think those that want to do that type of work, it's like, how can we get in there? Like we need to rally around it, not just within the schools, but also within our local communities, within households. It's just,
what makes a dietitian is a profession, right?
Absolutely.
Yeah.
Okay.
Yeah, absolutely.
So what you're saying is how valued is it now? Are there easier? Does everybody have a point of view?
One of the things that I heard you say earlier that struck me is my relationship with food.
Yeah.
And I think for years, dietitians got a bad rap.
Yeah.
Hey, if the food's bad, it tastes bad, you can't have much of it, you can't have this, you can't have that, you can't,
It was like can't.
Yes.
That's fair. Yeah.
Absolutely.
Instead of
Permission to eat.
you can have anything you want within reason.
Yeah.
And then you have to exercise, you have to, once a once or whatever,
But don't you also think it seems like things are trending? You cannot have carbs, you cannot have fat, you cannot have meat, you need more protein. I need protein powder, I need this, I need that. How do I know what's real?
Yeah, and I think that's where social media, different news outlets, conversations that we're going to have with peers, different settings, is we're going to be influenced by those things. And could we actually sit down with somebody that can discern and cipher through some of that, but then also meet the person where they're at
Sure.
and go into depth of their needs, their health history, their family history, what's the social, context.
Yeah.
So being able to really have, I think we're hopefully going to get back to, can I just sit down and talk with somebody?
Sure.
And really process this with somebody, but we want information quickly, we want it fast, we can seek it, we can use AI, and we can use, I don't even know all the
ChatGPT, all that kind of jazz. Let's kind of fast forward a little bit to what we were going to talk about today, and that is, what is trending? What are we going to see in 2026?
So this is one thing that is changing the landscape of nutrition right now, and why certain things are becoming, I think, more popular, is the increased usage and availability, even though they can still be hard to access, of weight loss medications.
Got it.
That is hands down to me the number one thing right now. That is,
As a pharmacist, you see.
Yeah.
Oh, absolutely.
Yeah. It is changing. So this is where it's going to potentially influence what supplements might get pushed, what things are different products that we're going to see.
Okay.
But it's shifting the relationship that people have with food. It's shifting the relationship that people have with their bodies, or that they've been struggling with for years. And so I'm not here to
be pro con. Yeah.
Yes,
No.
it's just really shifting the landscape.
So we can talk. I'm not pro or con either. So I also believe for the right patient, it's a great thing. I don't think we have enough information about the long-term effects. What you started, you're going to drop 20, 30, 40, 50 pounds. Now what? I can't.
The now what? Yeah.
Can't be,
Just the now what?
The now what? Yeah.
as like anything, if you don't change your behavior, that's you're just going to, when you stop, you're going to go right back to square one. Or what's worse, you've lost 40. When you stop, now you're going to gain 60, which is worse.
Yeah.
So all that's out there.
But are you losing weight?
Oh,
Not toning.
I can guarantee you lose weight.
Are you losing weight? Are you losing muscle? Are you losing fat? What do you do with all that?
Yes, and yes.
Oh, okay.
Yeah, right. So it's not the panacea, and it's also the you alluded to it with the everybody wants the quick fix. This is the American way. Why diet? Why exercise? Why do all the right stuff? And I can just take a bill for it.
This is just, and I am not one that, like, I'm on social media or pushing certain things for my own marketing, which is on me. But what's interesting is I have the amount of people that I work with that are trying to improve their relationship with food. They've struggled with for years. There's been less health coaching, nutrition coaching, sessions regarding weight loss. Now, this is just my
Anecdotal.
yes,
It's your commentary.
Is I think more and more people, 1 in 8 adults are using.
Is it 1 in 8?
1 in 8
are using a weight loss med,
or have used one. The rates have tripled. So since 2020, they have tripled in usage. In 2026, we're going to see oral, FDA approved. So there's going to be something called the Triple G that's coming out. That Eli Lilly is developing. That is going to be, you've got the semaglutide. I'm sure you. I mean, this is all your thing, but it's mind blowing how it's changing. And so instead of why not go on these?
Yeah.
If you've been struggling for years with monkey chatter and
food
noise and all of it,
I like monkey chatter.
I know.
yeah. And so where I see this, just for supporting anyone that would come wanting to take these or curious, is let's prevent as much muscle wasting. Can we still try to work on that relationship with food? Can we still practice movement? We want to get enough protein. We want to make sure we're not getting dehydrated. Like, we want to make sure we're getting enough fiber. So all of these things that I'm sure is being discussed, but is somebody supporting that along the journey as well? I don't know.
Is hangry a real thing?
Hangry?
Yeah.
I would say so, but these suckers are completely stopping that. I mean, these are like, for some, they might feel hungry on it, but for a lot, they're
Mostly don't even think about food.
No, I had a guy come and tell me, he says, I have to force myself to eat because the drug is so powerful. He says, 3, 4, 5 days will go by. I haven't even eaten anything.
Oh my
You hear no desire to eat.
Yeah.
Well, my husband was put on it by a physician, and he tried it, but he felt so awful, nauseous, food aversion.
Yes, roughly 50% of people will experience some sort of, I would say, more GI-related symptom, probably on the regular. But I've worked with people where they're experiencing those, and they're experiencing the weight loss to the point where they're gonna suffer through.
Yeah.
Power through it.
They are gonna power through.
He just went off of them because he felt like he lost part of the joy of his quality of life. I know, it's just really interesting. So then you're like, do I do it? Do I not?
So
Then we go right back circle to permission, right?
Yeah,
So
Yeah.
is because you can't
Not
as you can. It's just not a healthy way to live life of, I'm
Yeah.
going to take the drug and I'm not going to eat.
Well, it's been interesting for Lindsay and I because we've worked together in the field of eating disorders, and it's an addiction, but it's a process addiction, and the motto is you can't not eat. I can help you stop drinking, some other things, but I have to change your whole relationship with food.
Yeah, because we have to eat to
Have
survive.
to eat,
Yeah.
and now we're getting to the point where it's like, oh,
Yeah.
I want to talk about the labeling and you see, so I hear a whole bunch of people of, no sugar added,
Okay.
all this, or lowest sugar, but the fat content is through the roof to make it palatable.
Yes.
How confusing. How can people find out information of, all right, what are my values? Or I'm going to do, I'm a single mom. I've got 4 kids. We've got to eat. It's just so easy to go grab either a pre-done meal or a, Wendy's drive-through or Burger King something, which is, probably not the best choices. How do I read those labels? What's the best way to do that?
Yeah. So there's a couple of things that there's lots of parts of the label, right? So we've got what we first see, and that's where we're going to see the different colors. We're going to see where is it placed on the shelf, so all of that they're very intentional about where things are placed. So things that are high or low, but right in that middle sweet spot is where we're probably seeing things that there's probably a higher price point of getting things in those parts of the grocery stores as well. But I would say one rule of thumb is if it sounds too good to be true, it probably is.
okay.
If we're not certain of what something means, honestly, the USDA website is typically a really great resource to figure out terminology and what it actually means. Myplate.gov is another resource for people to go to that certain things do have to follow certain standards. Supplements, whole separate gamut.
What about those? What do you recommend?
So with dietary supplements, things do not have to be the ingredients, what is portrayed. The FDA is not regulating dietary supplements. So those, you want to do your homework and research very heavily on a dietary supplement. With the food,
What is a dietary supplement? Is that like a vitamin?
Vitamin, minerals, powders, those are just some.
Okay. All
Yeah.
right. So it's like
Yeah.
Flintstone.
You're not finding those in the middle of the aisle. You're finding those on like the outskirts,
Okay.
or a specialty shop or something like
Are
that.
you a daily multiple vitamin girl? Do you think everybody should?
I think people could. I like to think of it as almost like an insurance policy. Is just kind of like a daily multi, where somebody
From senior?
where somebody gets that. I mean, you could, yeah.
Yeah.
But like kind of going back to that label thing is there's that front piece that we are going to be influenced by. there's the side pieces where that's where we're looking at ingredients. That's where we're looking on that nutrition, like more of the nutrition facts. Everyone's going to go into it probably what's important to them. You know, for some, they're looking at it and they're looking for how much added sugar might be in a serving. For some, they're looking at sodium and how many milligrams of sodium.
I look at calories.
Some look at calories.
Hate that.
People kind of naturally start going towards certain things. On the ingredients, the number one ingredient, everything goes by weight. So it's what's contributing the most by weight. So that's something that people can look at.
Got it.
When you're looking at the nutrition facts, I like to think, first of all, this is based off one serving. It does not mean it is our portion. So what we actually end up consuming could be completely different.
Bummer.
And it's just a guide. By no means is it saying this is how much you should consume. It's just based off one serving. Here's the information based off that. But we're probably all going into it with different things.
What is your personal philosophy for 2026 when it comes to food? Ooh, see?
Oh, I had to think about that. Keep it interesting, joyful, nutrient dense.
What does that mean, nutrient dense?
Can we get as much? So I like to think of it as spectrum. So we have low nutrient dense and high nutrient dense. High nutrient dense are going to be the vitamins, the minerals, the healthy fats. Can we get a lot of nutrition? And these are mostly going to come from our whole foods.
Okay, so that would be an apple or a sweet
Broccoli, avocado, sweet potato, eggs,
Okay,
high nutrient dense foods.
nutrient dense. That's a good buzzword for us for 26.
I'll use the other end of the spectrum.
Yeah.
Oh, I do too. Yeah.
And then with that, the low nutrient dense, and we'll just use like the Pop-Tart as an example, you know, but it's fortified with vitamins. No,
It's fruit. I get the strawberry.
the strawberry, maybe the strawberry, yeah. But yeah, those are the things where it's like, does it have nutritional value? Does it give us calories? Yeah, it's going to give us calories. It is going to give us energy. And these are the things that we want to be thoughtful and intentional about.
How does blood sugar, or maybe I'm asking the wrong question, maybe it goes back to hangry. Does food or what we consume affect our mental health, or how does it affect our mental health, or does it affect our mental health?
Oh, huge. I would say right now there's a lot, I would say specifically more on mental health and stress and how it influences our appetite.
Okay.
And so if we are stressed, I'll just use this example. Let's say you have a really busy day. It's, you know, you've got meeting after meeting, appointment after appointment. You don't have time necessarily to sit down for lunch.
Correct.
And what you've been dealing with, maybe you've been putting out fires, what feels like fires all day.
Okay.
Your blood sugars will naturally stay elevated to deal with the task at hand because our body's really smart. It knows that it has to deal with these things immediately. These are the forefront. Are we necessarily hungry?
Nope.
No. We're pushing through.
Yeah.
Right? Are we feeling those hunger cues?
No.
No. But what happens around 5 o'clock when the day is done?
Starving.
We're starving. So once our body has the time to kind of settle down, calm down, even though we're probably thinking still about a million things, we finally get to unwind. We've had a very high stress day. Guess what we want to eat?
Something as fast as I can get.
Fast, convenient. Do you want, let's say, something off the grill, or would you rather go to Frankie Bones for, you know?
Yeah, I want a piece of pizza. Yeah,
exactly. You want it, which you want probably carbs. You want pizza. You want quick, easy. For some, it's sugar.
Because I'm emotional. I've been stressed all day. I just want to.
And it only makes sense that we're going to want quick, easy, soothing type things.
So some food can be more soothing. I love broccoli, but let's just say
no one wants to eat a salad after they've been
Right. I've had a strip.
right. And I think that's
So
where,
the precursor.
right. Yeah. So that's where our stress, our anxiety, our whatever we're dealing with, I think can really influence our appetite, our food choices, and then it can become this.
Well, and that's funny that you say that. So I go ahead and eat a piece of pizza at 5 o'clock, and then I'm like, oh my God, what in the world? Why did I just do that? And then I start saying, I've been good and now I'm
I
bad
don't think all that.
because I ate the
All you have is
pizza.
pieces of pizza.
Now we can look at more of the nutrition implication of, okay, what if it really wasn't necessarily a high stress day? Maybe we're feeling like we're in a pretty good state that day, but if we just didn't eat enough,
Okay.
well, then that can influence what we choose later on as well. So, and I think that's where the lack of fuel or what we end up choosing or what we don't get enough, if we don't get enough protein throughout the day, then that can influence things. I'd say for most people, they're going to struggle 4 or 5 p.m. on. Rarely am I hearing anybody wake up and they're like, oh my gosh, I have cravings. They're through the roof. It's usually,
Do we put a moral value on food? Because as I'm sitting there using pizza as an example, I'm like, is that a good food or a bad food? And I'm like, it's not good or bad. It's just pizza.
I think we've idolized it. I think food has been put on this moral compass. It is something that we connect it with our values, which I'm not saying that's necessarily wrong. It's more of,
Just be aware of it.
yes,
Yeah.
like if we kind of go back to this trend of 2026,
Yeah.
I think this concept of clean eating and pure and all of these things, that hasn't necessarily, that's been in existence.
Sure,
But I
yeah.
think that's also going to be something that we're going to see more of.
One of the things I want to touch on that you said, you're not hearing a lot of people say, I'm hungry late at night and stuff. I have also seen studies of, especially women, hormonal triggering eating cravings 10, 11, 12 o'clock at night.
Yes.
Where men, I had a big meal, I had dessert, I'm good, I'm going to sleep, I'm doing great, until morning. Where women, it's peaking,
Mm-hmm.
and they're in the refrigerator at 11 o'clock.
Yeah.
Because of hormones.
Yeah, absolutely. So if sleep's disrupted or if I haven't had time, I mean, 1,000%.
Yeah, I just did a study. There's a great study on sleep that people who have poor sleep habits have a history of obesity. There's a direct correlation between that, and it's really interesting.
Yeah.
Again, mind your health. We talk about the 4 pillars of health, and you really can't separate them out. We could sit here and talk to you for 2 days because we just get going.
Maybe we get something to eat.
Well, yeah, we would have
to take break.
a little to stop or something. But Lindsay, it's always really great to see you. We appreciate all of your insight and information. If you had a takeaway for us for 2026, what do you think it would be? What would you like us to remember about fuel and food and nutrition?
I would say something that just comes to mind to me for 2026 is to be intentional and aware.
Ooh, I love it. Thank you.
That's pretty broad.
I like that.
But no, and that really speaks to me too, because I'm in that same boat of, a long day. I just want something quick, and I'm going to open the refrigerator. I'm just going to take the first thing that feels to me instead of being
Intentional
about,
and aware.
I know what I'm going to have for supper, and in the morning I'm going to have this. I'm going to, have, salad with a little piece of, grilled chicken or something. That I think that's huge.
Well, thank you. Thank you all. Thank you all for joining us here on Mind Your Health.
Mind your health.